Welcome to UMCC Medical Consultant Connectors, where your health matters to us. The shoulder is a complex joint that allows for a wide range of motion. A group of muscles and tendons called the rotator cuff helps to control this movement. These muscles and tendons connect your upper arm bone, the humerus, to your shoulder blade, the scapula. They help you lift and rotate your arm. The rotator cuff also keeps your shoulder joint stable. A rotator cuff injury occurs when one or more of these tendons are torn. Tears can be partial or complete. A partial tear means that the tendon is damaged but not completely severed. A complete tear means that the tendon has been torn into two pieces. Rotator cuff injuries are common. They are more likely to occur as we age. They are also common in people who play sports that involve repetitive overhead motions, such as tennis, baseball, and volleyball. There are many things that can cause a rotator cuff tear. Some tears happen suddenly, such as from a fall or a direct blow to the shoulder. These are called acute tears. Other tears develop gradually over time, often from overuse or repetitive motions. These are called chronic tears. One of the most common causes of chronic rotator cuff tears is impingement syndrome. This occurs when the tendons of the rotator cuff are pinched between the bones of the shoulder. This can happen when you lift your arm overhead repeatedly. Another common cause of rotator cuff tears is age-related degeneration. As we age, the tendons in our bodies can become weaker and more prone to tearing. This is especially true for the tendons in the rotator cuff, which are subjected to a lot of wear and tear over time. The symptoms of a rotator cuff injury can vary depending on the severity of the tear. Some people only experience mild pain, while others have severe pain that makes it difficult to use their arm. One of the most common symptoms of a rotator cuff tear is pain that is worse at night. You may also experience pain when you lift your arm overhead or reach behind your back. In some cases, you may also feel a clicking or popping sensation in your shoulder. If you have a rotator cuff tear, you may also experience weakness in your arm. This weakness can make it difficult to lift objects or perform everyday tasks. In some cases, you may also have difficulty sleeping on the affected side. Section 4. Diagnosing and treating rotator cuff injuries. If you think you may have a rotator cuff injury, it is important to see a doctor to get a diagnosis. They will ask about your symptoms and medical history. They will also perform a physical exam to assess your range of motion, strength, and stability. To confirm the diagnosis, your doctor may order imaging tests, such as an X-ray, ultrasound, or MRI. These tests can help to rule out other conditions and show the extent of the damage to the rotator cuff tendons. Treatment for a rotator cuff injury will depend on the severity of the tear. If you have a partial tear, your doctor may recommend conservative treatment options such as rest, ice, compression, elevation, over-the-counter pain relievers, and physical therapy. Physical therapy is an important part of treatment for rotator cuff injuries. A physical therapist can teach you exercises to strengthen the muscles around your shoulder and improve your range of motion. If you have a complete tear, or if conservative treatment options are not effective, your doctor may recommend surgery. Surgery for a rotator cuff tear usually involves reattaching the torn tendon to the bone. This is often done using minimally invasive arthroscopic techniques. Section 5. Preventing future rotator cuff issues. There are a number of things you can do to help prevent rotator cuff injuries. These include warming up properly before exercising or participating in sports, using proper form when lifting weights or other heavy objects, strengthening the muscles around your shoulder with regular exercise, stretching your shoulder muscles regularly, and avoiding activities that put excessive stress on your shoulder. If you have any risk factors for rotator cuff injuries, such as participating in overhead sports or having a job that requires repetitive overhead motions, it is especially important to take steps to prevent these injuries. By following these tips, you can help keep your shoulders healthy and strong for years to come. UMCC, your ultimate medical consultant connectors.